better from here.
Okay. Hi, everybody. Sorry for the delay. We had a little glitch there, but thank you for joining us on our Friday webinar. We are back with Ask the Vet with Dr. Tom Tully. Welcome, Dr. Tully.
Well, thank you, Laura. Thank you. Just returned from our veterinary conference in Denver, and as it always is, very exciting, and always new medicine to actually learn about, and to treat the animals that we see, and to improve what we do. So
sure, it's a busy time, right? A lot of catching up with colleagues, and talking to probably the new incoming vet students and all that good stuff.
Very much so. Always looking for new veterinarians that are interested in avian medicine in particular, to train and to get out there. We always need more veterinarians that are knowledgeable and have an interest in avian medicine. And I'll say that there are, and many of them were actively participating in the conference to get better and learn more about what they're interested in.
So wait, so you get dog and cat vets, so to speak, that want to branch out into avian medicine, or?
No, well, sometimes you do. I talked to a few veterinarians there that had an interest, that said that I'm just looking to see more of these patients and learn more about it. And that's what I always tell people, is that you always, who have birds and who are seeking a veterinarian, is first of all, you want to seek somebody that really has an interest. They may not be a specialist, but they're a good doctor, and if they have an interest and want to do the best for your bird, then that's a great start. That's a great start.
Well, there we go. All right, and I'm sure you got another one coming up probably. You do some conferences throughout the year in addition to all the other work that you do. So
yes. Yeah, there's usually we have our European conference. I'm active there, and then with that specialty college, because again, they do, there's medicine that's occurring worldwide that's a little bit different, and we always want to stay at the top of our game, and be able to provide the latest medicine for our patients. And you just have to go out and seek it. But this is a big one. This is that we just had, so it was good, and it was good to see everybody. We're really the first conference since COVID. We did have it last year, but many people didn't come. It was still virtual also. This year it was all on site, and that made it much better, but it also gave everybody a chance to catch up and see everybody.
Nice. And then, so thank you for joining us today after that whirlwind of travel and stuff. So especially appreciative today. So are you ready for some questions?
Well, let's go, and let's try to see if we can answer all the questions today.
All right, we'll clear the question queue today. And so let's see. So we have just a reminder, if you do have a question, use the Q&A button, not chat, but Q&A button. And okay, so we got our first question about a 33-year-old yellow-naped Amazon with enlarged air sacs that was diagnosed by the vet. So they want to know what this means, is it, and the dangers associated with it. It says the notes from this question are: client was not with bird during exam due to COVID protocol, inadequate communication with the vet. The vet mainly said nothing to worry about. Bird has always had regular vet checks with labs, never had any respiratory issues. So what say you on that?
Well, the one thing that you want to first try to understand is what is meant by an enlarged air sac, because for those that aren't familiar, birds have nine air sacs, and that's not including one that is in the upper respiratory area, the cervicocephalic air sac. Now, enlarged, these air sacs are all in the body. And so really the bird is a respiratory, I guess, machine, if you will. That's why hummingbirds, think about hummingbirds, they migrate, they fly from the US across the Gulf of Mexico to the Yucatan Peninsula. They migrate. Can you imagine a hummingbird flying that long for that far? There's geese that fly over the Himalayan mountain range, and you're looking at something that is 30,000 feet, is Mount Everest, give or take a foot or two, but who's counting? But you look at the heights that these birds fly and the migration, and some fly from Canada to South America to Patagonia. That is amazing. And so they're respiratory machines. And so what makes them that? Well, one is the lungs are a little different than mammalian lungs. They're more efficient, more sensitive. We know this. With some of the toxins in the environment, like the canary in the coal mine we've talked about before. They're more sensitive, but their respiratory system, their lungs are much more efficient than the mechanisms that we have. But I'm glad what we have because they work, right? So anything that's not within the body of the bird, that's an organ or a body system, say like the intestinal tract, vessels, it's part of the respiratory system. These are air sacs. So that's, and it takes 2 complete respiratory cycles, in, out, for the bird to get actually 1 volume of air, the majority of 1 volume of air through the body, where we only use one. Inhale, exhale. But the bird, it's 2. Now, keeping this in mind, and you go like, well, why is this, how's this related to the question? As we do sometimes, you go like, Dr. Tully, where are you going with this? Well, the one thing is that if you have an enlarged air sacs are enlarged, I mean, they're kind of confined by the body, so it's not really, it's kind of hard to understand how that would be enlarged or not. Birds also have a kind of I wouldn't call it a disease problem, but they do have an injury, or they do have a presentation where, and particularly the air sac that's down into the upper respiratory system that goes down the neck, and this you can have a tear in the overlying, through the air sac, in the overlying tissue, where the air will go out of the air sac under the skin, and so they'll sometimes call that a ruptured air sac or whatever. But it looks like the bird has is just ballooned out. Basically, it's air under the skin. Pelicans kind of have this naturally. It kind of helps them float a little bit. They don't sink. But but as far as birds, it can kind of get big, and you can actually put a hole in it, and all the air will come out, and the skin will go back down. But once that hole closes up, it'll get back here. So I'm not sure what they mean by an enlarged air sac. The only way you can tell if it's an enlarged air sac inside is with x-rays. You can take radiographic images and they can tell if it's enlarged, but that's kind of a rare occurrence. But then you have these where you have these subcutaneous emphysema, we call it, where you have a ruptured air sac or a tear in the air sac and it goes under the skin. And then that's a whole nother ball game in which usually we try to compress it. And if it heals early, that it'll stay. If there is a fistula that forms a connection where it's open all the time, well, that's more problematic because there's methods that we try to use to keep it down and also try to actually close that hole. So I wanted to, with this question, it's an enlarged air sac. Inside, there's not many things that would be an issue, but you do have these where you have what we call subcutaneous emphysema. And that is something that if it occurs suddenly, sometimes it's on the body. We'll have little birds where they'll get this air on the it'll be out of side, where the body is kind of has just air under the skin. But it's from the a tear in the air sac and the air gets out. So that's something as it relates to air sac problems, which is an extension of the respiratory system in birds. And that is anything in the body that is not occupied by tissue is usually an air sac. Mm-hmm.
All right. Ready for the next one?
Yeah.
This is about a baby gray. So they're buying a baby gray from a reputable breeder, and she put him in a holding cage for one night, and the gray scraped the small area on his head. Not a serious injury, but they want to know if the feathers will grow back. And I'm going to do a screen share of the photo so you can see for yourself the little gray's top of his head. So let me see.
This is technology at its best, Laura.
It is, although let's hope that I'm the one behind the
oh, there it is.
There we go.
Oh, yes.
So
I see.
Let's see this little patch here.
Yes. And that and I'm happy to say that those feathers will grow back. There's never a guarantee, but I would bet on it. Most of the time when you have scrapes like that, and actually it reminds me of a story they had, and speaking of feathers growing back, and this looks like there's not a lot of trauma involved. There's a little scrape there, but not much. But they used to have the USDA and U.S. Fish and Wildlife used to have auctions, bird auctions at specific areas, usually along the border. They probably had them in San Diego or below San Diego, this side of Tijuana. They probably, where I went was in McAllen, Texas. This was many years ago, about 1989, actually. And they would have these auctions, and so it was great because they would confiscate these birds and they would hold them, make sure that they met all of the importation requirements, and they sold them. And what was great is that they didn't kill them. And so kudos to the Fish and Wildlife Service and the USDA for doing this, because it allowed them to get money and continue their program of protecting the birds here in the US, but also it saved those birds. There were a pair of lilac crown Amazons, and what they would do is they would some of the people that would smuggle or sell the birds, they would use bleach, like Clorox bleach, and they would put them on the feathers of the head, especially green parrots and conures. If it was a small green conure and their feathers turned yellow, it was a baby yellow-naped Amazon or yellow-head Amazon. because people are going to buy a green parrot with yellow head if they don't know anything. So these were fully grown green conures with yellow feathers on their head. So they did this to these lilac-crowned Amazons, but unfortunately, you know how irritating bleach can be. And these lilac-crowned Amazons didn't have a feather on their head, and there was a lot of inflammation. And so I bought those birds because really nobody wanted them because they looked so bad. They didn't have any feathers on their head, and there was a lot of irritation and damage, tissue damage. Now, I bought them because I said, I'm going to treat them. I'm going to, even if they never grow any feathers back, at least I'm going to try to save the birds. Well, guess what? Their feathers grew back with all of that tissue damage, and they were beautiful. So this kind of leads to this question and gives people an idea on how well the feathers could grow back even after damage, because these lilac-crowned Amazons, they had such terrible sores and no feathers on their head because of this, but they grew back. I really have no doubt that these feathers will grow back on this little gray, but usually it takes about something like this where you don't have a lot of tissue injury, about 6 weeks or so for it to grow back.
Okay. And will it grow back in the same color, same
Usually,
direction, and all that?
Those lilac-crowned Amazons, when they grew back, those two birds were, those could have been on the cover of the lilac-crowned Amazon book. They were that beautiful. Yes.
Right. Okay. All right. So there we go. There's
now you bring up a point that they may, they could be a different, it could affect the depending on the injury or what have you, it could be a little bit different. But in most cases, even if they grow back different color initially, after repeated molts, they probably will be fine.
Okay. All right. There we go. There's the answer to that one.
Yeah. So there you go. Yeah.
And you don't need to put a Band-Aid on that.
No.
Just
if there's something like that, you could get a little Q-tip, get a little Neosporin on, just triple antibiotic. None of the, there's about 800 different types of Neosporin, but just a typical triple antibiotic, and just make it glisten. You don't want to put a glob or anything like that on that if it's something, but it had just to glisten. Yeah.
Okay. All right. And our next question is about a Senegal that's been placed on, sardial or sardial. Does that sound?
Yeah. Okay.
For high bile acids, can the meds be stopped when the reading drops to a normal range, or is this a lifetime medication for them?
Usually, it depends on what what it's being treated for. But in most cases, it's extremely rare that I'll prescribe medication or look to prescribe medication for a lifetime treatment. And I'm not actually sure about all of the case, but I would think and hope when you have medication like this that it may be involved with a liver issue, that it would be something that once you have whatever the situation is, where you have maybe liver function is not as good as it could be, that once it, we're being optimistic and looking and that the treatment and it will improve, that you can discontinue the medication. So that would be the hope. There's very few medications that you you provide that it's like, well, it's got to be on it for the rest of its life. The drug companies don't like that. They want you to take it forever, but for the most part, I like to make sure that, it's given when it's needed. Now, it may be possible that it needs to be given for a longer period of time, dependent upon how the bird responds and how it overcomes what its condition. But for the most part, once it gets back on track, the medications can be discontinued.
All right. And then this next question is from Susan, and it's about the African gray loves Bob's Red Mill 10-grain cereal. And so they give him about a teaspoonful every morning. Is that okay for him to have?
I'm gonna have to try it. It sounds good, but no, I think that is that's fine. I'm not familiar with it. It doesn't sound like it doesn't really sound like it's not a lot. It's a teaspoon, I think, and probably doesn't have a lot of sugar in it. That would be my only thing that I would be looking at. But otherwise, that sounds like a reasonable treat by all means.
Yeah, I just looked it up, and it's a it looks like it could be a hot cereal, like almost like an oatmeal kind of thing.
Yeah,
It's very healthy.
Yes, I'm sure. And if he likes it, then that's great. That's great. What a way to wake up in the morning, right?
I know, right? It looks,
I'm sure he's right out there like, where's my teaspoon of the cereal?
All right.
Maybe wakes him up to get his cereal. I don't know.
Probably does. And he's a gray, so he's probably asking for it by name.
Yeah, exactly. Yeah.
So next question comes from Sandy, who says that we know birds need UV lighting. So this is a separate question. Does LED lighting in homes/apartments cause issues for birds? There is a push to upgrade lighting to LED, but they've heard the LED lighting has flickering that we can't see, but birds can. So what do you think about the LED lighting?
Well, for the most part, fluorescent lighting, I think, does also, although that's not my area of expertise, but I don't think at this time, I mean, and that's LED, the future is here, right? So I think that I haven't heard of any issues with that. I really don't foresee any issues with that. So I wouldn't be concerned unless we hear something in the future. And I know that people have had LED lights for a while now, but I haven't heard any issues. But good question. Yeah. Always it's always to be aware and look at the potential possibilities than to not. But good question. Yeah.
Okay. The next one comes from Frank about a 5-year-old blue-fronted Amazon with a very small, about 1 millimeter brown patch in the feather directly above the left nair. No symptoms and normal behavior. They noticed it's present for several days. So is that something to be concerned about, like a brown patch in a feather?
The one, what I would do is to kind of investigate it more, although sometimes with our feathered friends, they like to kind of control what's going on, and so it may be if they don't want you looking at the feathers around their nose, they're not going to let you. Easy. One thing that you can try to do is to see if it is the feathers itself, or if it's something within the feathers. Sometimes you can moisten like a Q-tip and just kind of rub the feathers. Maybe you'll like that. The little blue front will like it. And so if we're talking about a blue front, well, in the area that you're talking about, maybe this brown patch is in the blue feathers, right? So you can rub it to see if it's something that is in the feathers, and if it just came up, it's rare that it would be just like the feather change color. So it's probably something that you can remove, and if it's a raised area, then it could be something that needs to be investigated more. If you see that, if it's a raised area, because it could be a little abscess or a little growth there. But just to get a little bit more investigation and see if you can wipe it off, or if it's kind of stuck within those feathers. And if it's more involved, then that needs to be looked at.
Okay. And then Judith had a question about a 16-year-old Myers parrot that just laid 5 eggs. 5 eggs. 16-year-old Myers parrot. First eggs too. Is that normal? Is that normal for that to happen? And they want to know, can I breed her? How long could she live? So a few questions there about the Myers. 16-year-old Myers laid first eggs, clutch of 5.
So it's a 16-year-old. Did you say 16-year-old Myers parrot?
Yeah.
And it just laid its first clutch of eggs.
5 of them.
5 of them. Yeah. Like, when I'm going to do it,
a handful.
I'm going to do it well, right?
Yes. I want to make up for lost time here.
Yes. And I would think, based on the question, that there's no male in the cage with this bird. Well, because she asked if it could be used for possibly reproduction and getting baby Meyer parrots. That's what I'm thinking. So to answer that, yes, it could be used for breeding, to find a male and set that up. Obviously, everything's functioning on her end, and so that would be the case. How it relates to that shouldn't have anything to affect her age, whether she is reproductively active or even goes again to a breeding situation. That really shouldn't affect her age. The nutrition, calcium supplementation for the egg development and all that's all part of it. Then so as far as the length of time, again, you're talking about a smaller parrot here, and it I would say that generally the life expectancy of a bird like this is probably 25 to maybe even 33, somewhere 35 years, 25 to 35 years on a bird that size. Yeah. So the question is that what does she think about? I had a cockatiel lay its first egg at 7 or 8 years, and so I mean, I had an owner of a blue and gold macaw DNA sex the male, lay the first egg at 28 years of age. So 25,
Wow.
28 years of age. So this isn't unusual. DNA sexing is, for the most part, you're looking at it is correct, but mistakes have been, and people probably out there know they've been made. Surgically sexing, even looking at the gonad, you can make mistakes. It's not 100%. That is blue and gold proves that the DNA sexing isn't 100%. But even with the most reputable companies, that can occur. So yes, and remember, these are fixed. If you get it with another bird, it is an arranged marriage. It is an arranged marriage. You can say that, well, that's a male, he looks like the female, and let's put them together and they'll live happily ever after. If an alien came down here and said, well, this is a male of the species and this is a female, put them together and they'll live happily ever after and reproduce, you know about that.
Yeah.
And so keep that in mind. Anytime that you put a pair together, you are arranging the marriage. And no matter if they look the same, and there's stories about the birds going down the aviary and kicking one out. This pair hasn't been reproductively active. And you're going like, gosh, when are they going to go? Yeah. And then one goes out into another cage, kicks one out. True stories. And then within, a month, they're laying eggs, so.
Yeah. So it's, there's no guarantees.
Yeah.
I'm happy. That's a good point. All right. Oh, okay. So we just got a note from Jean, the African queen. Hi, Jean. So she says that Myers are choosy and bad about killing the mate if they don't like them. So
there you go.
About, the African species. There you go.
Yeah, but it is a point, because people want to know why my birds aren't laying, why the birds aren't laying. And that brings the point of the arranged marriages. I like to put this in something where people can understand. And we're fortunate that many of our arranged marriages work, right, with the birds. Aviaries like, where Laurel Park in the Canary Islands, they have the opportunity to put 6 male macaws in a cage and 6 female and let them choose their mates. And that's optimum. We don't have that luxury, but it is something to consider. And I like that comment. I mean, I don't like it because we know cockatoos can kill their mate, and eclectus. We all know stories about that. And well, that's the Senegal. I mean, the Myers. I wasn't familiar, so thank you. That's what this whole webinar, we all learn.
Yes.
And I like that. I like that. Thank you. On that, I'll remember that.
There we go. Thank you, Jean. This one is a question from Laura. A nice name. Sorry. I'm trying to feed healthier food. They have 3 questions. So trying to feed healthier food choice, offer healthier food choices. He really likes quinoa. Is it okay for him to have like a tablespoon of quinoa every day? Is cauliflower safe for a bird to eat? And then the final question is, recently my bird was eating his own poop. Why would he be doing that? And is there a way to break him of that bad habit? So is quinoa good? Is cauliflower safe? And how do you break a bird out of eating its own poop? And is that okay for them to do?
I haven't heard anything adverse about the quinoa. I haven't heard anything adverse about cauliflower. Again, it's one of those, you want to try to, again, the diversity and the amount that you provide. And it's always about the question that I try to teach the veterinarians and the students, the veterinary students, and it remind that it first came to really my attention when I had a physician lecturing the students, and I think we may have talked about it before, but it's always something to remember, especially on something when we're talking about different foods. But the physician, it says, really it's the important questions to ask, but it's something for bird owners to remember. It's not, you want to feed them a good diet. Quinoa, you can put, cauliflower. I haven't heard any problems with that. But the nutritional offerings of each are different, along with everything else. So it all goes back to a diversified diet. It isn't what you feed it, it's what the bird eats. It's what the bird eats. So remember to, when you're, as much as and for those that really care and put the effort into making this diet and dietary offering for your bird, keep as much say, well, what does it like? What's it eating? I'm putting this in there, but it's always coming back, and so keep that in mind, and because you want to make sure that bird gets the diversity. It's not necessarily bad to, or there may not be anything wrong with feeding the individual aspects of a diet, but if it only eats one thing or two things, then it's having a very narrow nutritional intake, and so that could lead to issues. So that, keep that in mind. And the last question was
bird poop, eating bird poop.
Eating bird poop. Well, no wonder I forgot that one. I didn't want to even think about that. So it happens, right? And so again, why is it doing that? I wish I could have an answer to tell you. The one thing that I can say is that if you're offering a good diet, a good nutritional offering to the bird, then there shouldn't be really any type of a reason for that. Also, birds don't have for the most part, they don't have we call that coprophagy, as far as eating the poops, but rabbits do, to get bacteria, good bacteria. Birds not necessarily on that. And so the only thing that I can say is just make sure you keep the cage clean to try to reduce the bird from doing that, and keep offering a good diet. And that should, I don't really see that being a evidence of a disease problem or something that's wrong with that. Just behavioral for the most part. Then we'll leave it at that.
All right. And that's why, some people leave the grate in the bottom of the cage, and some people have removed. But if you have a poop eater, maybe make sure the grate's on so they can't get to the whatever the lining is with the poop.
Yeah. Yep.
Yeah. Poop, yeah.
Thank you. Thank you, Laura. Yeah, anything to kind of reduce, and it's just a bad habit.
All right, there we go. Jeannie asks, can a bird who needs meloxicam for arthritis take meloxicam for people if the dosing is correct? Like, what would be the percentage?
Well, for the most part, it's the same drug. The problem is that I'm not sure what the concentration is as far as the human meloxicam is concerned, but I would think that it would be similar, but I'm not gonna I don't know on that, but I would think it's the same drug, but I just don't know what the concentration is on the human formulation and what is on the veterinary concentration. You know,
that would definitely be different, right? A different percentage.
Yeah, I mean, one like is more concentrated than the other, but that would be something. I haven't looked at the formulation, but like I said, just off the top of my head, I would say that it's the same drug, but I would just have to make sure that the formulations would be the same and what the concentration of the drug is within that because I don't know is the even, well, I'm glad I don't know, but is the human form a tablet form, or is it an oral form? I don't know. You would think if it is like an NSAID, it would be something similar to Advil, or it's in a capsule or some kind of tablet, where we have the burden of our patients not taking those.
Yes.
Here you go, take your little tablet.
Well,
It's hard enough to get them to even take the syrup, right?
I didn't know Nutriberry.
That's a good question, but
yeah,
it is. I mean, a lot of the medications that we give are the same, but in different formulations and different concentrations than what humans take. Yeah.
Okay. Next question is from Barbara. They have 2 rescued umbrellas that are between 25 and 30 years old. Both have cloacal prolapses and came with histories of failed surgeries to repair them. They don't want to put them through further surgeries. Is there anything that they should do to keep them as healthy as possible without traumatizing them again?
Yeah.
And this is a species that you probably see it more so, right? When cockatoos.
Are these what are these, male, female?
No, don't know yet, but maybe we'll if
yeah.
this we'll get in there.
The one if you have a prolapse cloaca, the main, and you're not putting them through any surgery. There was a newer there was a surgery that was published last year that was a little bit different, that was allowed it to stay in, although there's as has been stated in the question, that there have been previous surgeries, and those surgeries include cloacopexy, where they actually go into the surgeon goes into the coelomic cavity and puts and ties the cloaca to the body wall and ribs to keep it in, but it doesn't reduce, and any of these surgeries that we're talking about does not reduce the cause of the prolapse. Usually with these cockatoos, it's related to hormonal issues, and the hormonal issues do not go away just because you cinch the cloaca into the body, and or you put a purse string suture around which is very tricky, because if you put it too tight, the bird can't poop. And if the bird can't poop, that's not good, naturally. And if you put it too loose, it'll prolapse. But all you're doing is keeping the cloaca in the body. And if you tie it up into the body, it'll keep it in there for a period of time, but eventually the pressure on that tissue, constant pressure of trying to get that out, it'll break down. And that's something where they do the PEXI, and then there's a surgery to reduce the size of the vent. But again, that pressure, because of the hormonal influence on these birds, will break it down. And so the only way to really give yourself a very good chance of reducing the of preventing this constant need to prolapse is to remove the remove the testicles or the ovary, which is a very risky surgery in birds because of where those gonads are located. And if you do that, then that will give you the best chance of, you don't even have to do the surgery. So they just stop prolapsing at that point. So the other thing that can be done, although they don't last long and they're expensive, is the implants, the deslorelin implants. You can put an implant in the bird. Unfortunately, it only works for a short period of time, and they're not cheap. They're about $250 to $350. So they're not cheap. And so if you put one in and you say in 2 months, like, oh my God, it's doing it again. Well, you can, 300, times 6, that's a lot of money to go all year. So other than that, you'll have a prolapsed cloaca, and you can put a purse string in for a period of time, a good purse string, and that'll keep it in. But if the prolapse occurs and you don't, but you'd have to do that again anytime you put a purse string or something of that nature in the bird, it has to be under the guidance of a doctor. Because like I said, you put, something like that's put in and you just cinch up the cloaca, it's not going to urinate, defecate, it's just going to fill with, it'll become toxic and die. So that has to be done very carefully and done under the guidance of a doctor. Now, if you don't do anything, you have this issue. You have to keep that tissue moist. You have to make sure, because all of these birds, they soil all of those feathers, and urine and fecal material are all on the back of those birds. You need to make sure that those are clean, that's clean, and any tissue that's out is maintained moist, because it'll dry out and become irritated more so than it already is. These are difficult cases, I can tell you. And if you don't keep that tissue in, it will become irritated and inflamed and possibly infected. So that's a great question. Wonderful, that you've got these 2 birds and trying to take care of them. But this is a big issue with, in particularly cockatoos.
Okay. Next question is about a sneezing bird, a bird that has been sneezing quite often for the past 4 months. The vet has done 5 nasal flushes and nothing comes out, and the vet does not think it's a respiratory infection. So they have an air purifier and they don't use fragrances, etc. the vet said the last step could be a CT scan with contrast to see if it shows anything. But he says that it's a risky test and could come back inconclusive. So is there anything else that they can try instead of the CT test? And you know, the bird's well taken care of, has regular showers and steam in the bathroom a few times a week. Other than the sneezing, he's happy, healthy, poops, appetite is all good. So what could cause it, and what can they do to investigate it?
Yeah, I think that as far as the the sneezing, I'm not sure what type of bird. It didn't say what type of bird it was, really. But in this case, what I have to have go on is that the bird wasn't sneezing, and then it started sneezing about 5 months ago, and
Oh, sorry, 4 months ago.
Yeah, 4 months ago. And so so obviously the sneezing was more than the one-off sneezing. Undoubtedly it's enough to get this owner's mind here, and to take it and to check it out. Now the flushes, you know, the one thing that I'm gonna kind of just ask, and you know, just not, you know, kind of rhetorically ask these, is that was there any nasal discharge? Was there any evidence in the choana, the interface? Was there any evidence of inflammation within that upper respiratory tract? If the nares and the choana were in the oral cavity where the upper respiratory system drains, if it was normal, then that would be something that that definitely would be somewhat of a concern. Why is this bird all of a sudden started sneezing with there's nothing within the environment that would irritate the nasal mucosa? You know, like, oh, you walk into somewhere and there's something, you breathe in and you start sneezing, whether it's dust or something within the air. If nothing is in the environment that would cause it, and there's no other clinical signs other than the sneezing, then that would be something that where, you know, that was a good suggestion, a CT. I don't know again what size bird this is, but for the most part, what you're looking at when you're looking at a CT, you're going to be able to look at those sinuses and see if there's anything in there.
Yeah,
it's not
uncommon. Sorry, I just got an update. It's a mustache parakeet, and there's no a mustache parakeet, no inflammation of the nares.
Okay, so then if there's no inflammation, no nasal discharge, no other signs of any type of upper respiratory, it doesn't appear that it would be an infectious issue. It doesn't mean it's out, but what happens is that if bacteria or some that it would be causing inflammation, irritation that we don't see. Then you have to look at, well, what else could do it? Well, it could have been eating something and just breathed wrong, and a seed hull or piece of whatever went up into its choana and it's up there. And I know that you flushed it, but obviously that didn't, if that was it wasn't removed. Then the other possibility is if there's a nasal polyp of some sort or some growth in there that may be irritating it, which is why you would look at a CT with that. I don't know if you need necessarily contrast to look at that. That means that they have to inject contrast. They do a CT scan, but to enhance the tissue, you have to inject contrast material And so you get better images of certain areas with the contrast in there. So you say, well, I'll just take a CT image. Well, we can, but in certain times, if you're trying to look at tissue, if you possibly delineate what contrast can be taken up by fast growing tissue, like in tumors or something of this, or where the tissue isn't, where, it's highly, there's more blood in there, they can see that. So that's why contrast is used to enhance CT images more than just CT images themselves. We just did a study where we did and found that the intraosseous, putting contrast in small bird and bone, that it works as well as IV. And so it's ways that you can image small birds to try to make diagnoses, and in particular the sinuses. And the sinuses are difficult, and that CT is probably, if it's not improved with the signs that you have, that was a reasonable recommendation. That would have been my recommendation based on what I'm hearing here. Yeah.
Okay, that's okay. There we go. And let's see. I think sorry, that just blew by again. We still have some more questions, but we'll either email answers or maybe we'll address them the next go around. This is like I don't know, I think it's like your 26th Ask the Vet with us. It's like
but there's more questions.
I know. So
we'll get them. We'll
address them.
We're getting there.
We're getting there.
Yes, but thanks to all of the attendees. It's great.
No, it's great, and it's, you never know what you're going to get. So it's like we learn each and every time. It's just
yes.
So I'm gonna
parrots, make sure that she likes the mate.
There we go. We don't want to deal with the parrot couple counseling out of everywhere.
No.
All right, so I'm going to announce today's winner of our giveaway, which is going to be the newly launched Lafeber foraging pack, and that's going to go to Dawn Sipes. Congratulations to you and your bird. Lafeber office will get a hold of you early next week. Send that out to you, as well as another package, another food of your bird's choice from Lafeber. So, great questions, right?
Yes.
And then just also wanted to give everyone a sneak peek on next webinar. We're going to be back on with Lisa Bono and special guests. So we're going to have Dr. Arose and Ann Brooks, and they're going to give us a behind the scenes view of the recent Phoenix Landing conference that was earlier this month. So kind of go behind the scenes on that whole event, as well as how it started and what topics were addressed and all the good stuff. So you want to tune into that next Friday. And let's see, what else do we got here? Oh, just a lot of thanks. So that was thanks everyone for joining us today. And Jean Pattison, I remember contributor to Bird Talk magazine back in the day, so it's good to see your name, familiar name. So thanks for that. And everybody have a great weekend. And until next time, Dr. Tully, thank you for your time again.
Thank you.
Then you'll be off to a jet setting to another conference and coming back and joining us. So all that back and forth and making sure you make our Friday Ask the Vet is very special for us. So
treating the birds here. So
that's right.
So that's it. And then again, thank you, Laura. And thanks to all of our attendees. And I did see at the conference, I did see Dr. Soga from Japan. So she had come in, and I thanked her for attending. She usually is one of the attendees. And she's doing well, and it was great to see her.
Oh, so, that's awesome.
We love you, and till next time.
All right. On that note, everyone, have a great weekend. All the best to you and your flock, and everyone stay safe. Bye.
Thank you. Bye.